Jill here, and welcome back. It's great to see you. So I've put the skeleton on the stand here, as you can see, and we're going to be beginning to talk a little bit about the spine, because it's an area that most people have an interest in, and it's actually it's a very common place for people to complain about, aches and pains. So they've got neck pain, back pain, shoulder pain, or whatever. So we're going to start a little bit off just by very simply showing you these really very natural curves that there are in this whole structure. You can see that if you have a look from top to bottom, you can see this inward curve here, and then an outward curve, another inward curve, and then another outward curve like that. So this is perfectly normal, natural to have this undulation like this. And everyone has a slight variation. Some people have very pronounced curves here, very pronounced curves here, roundedness here, etc. But in general, this structure of having these curves is completely normal. Now this curve here, right down at the bottom, and this curve here, if you think of a young baby, when the baby is born, the baby is going to have these rounded curves here, and then actually, as the baby is being born, there is a tendency to get some, arching away, and then as a youngster, we learn in babies, we learn to create some of these inward curves. So these more outward curves like this are a sort of more primary curve, and then the inward curve are more of a secondary curve. But as I say, if you have a look, you can see there's a perfectly natural shape of curves that runs down through here. So if you have a look in the mirror and you turn sideways on, what you'll find is that you can see these curves. You can see you have this natural curve here, and that's perfectly normal. It's perfectly normal to have these curves that go in and out. It's also quite natural for some people to have a relatively flat, straight spine. But if you have a look at this one, you can see these primary and secondary curves. There we go. I'll turn it a little bit so you can see it. There, you can see a little bit more pronounced. See there, you can see the curves going through. Okay, see you again.